Alliance India and Frontline AIDS have been working together since 2001 for 20 years, when Frontline AIDS was known as the International HIV/AIDS Alliance. Alliance India is one of our largest partner organizations, and they play a key role in the Frontline AIDS partnership. We've worked with Alliance India, supporting marginalized communities, foster well-being, realize equality, and affirm the dignity of communities most affected by HIV and AIDS in India. Alliance India has always held a large portfolio of programs, both working with us and other organizations, and both working nationally and internationally. Programs have included HIV prevention, harm reduction, quality of life of people living with HIV, and sexual and reproductive health and rights. Recently, we have seen Alliance India take a leadership role around the work we do under Action 5 of our Global Plan of Action, challenging harmful and discriminatory social and gender norms. Under our Zero Violence program, which was funded by the Foreign, Commonwealth and Development Office here in the UK, Alliance India, which worked as part of a consortium of partners to pilot the draft Gender Good Practice Guide. The pilot process was a resource to strengthen global technical assistance in programs and advocacy across the Frontline AIDS partnership. We've also supported Alliance India through the Accelerating Innovation Grant funded by the Elton John AIDS Foundation in their efforts to reach those communities that are already most marginalized and who are now being so severely affected by the COVID-19 pandemic in India. Alliance India has been working tirelessly to ensure that equipment, medication, and support is available to those most marginalized. Alliance India's impact is far-reaching, but also has real depth to it. They work to ensure that their programs are sustainable and therefore have a real impact that goes beyond just the work that they implement. In 2019, Alliance India reached over 1.4 million people with sexual and reproductive health and rights interventions, including HIV. They also reached 1.3 million people from marginalized groups with HIV prevention activities. What an amazing achievement. In 2020, Alliance India worked with the Mizoram Drug Users Forum and successfully lobbied the government to allow new clients to register for opiate agonistic treatment. The government even went on to allow take-home methadone, which it had been opposed to for years. Through the Zero Violence program in 2020 and 2021, Alliance India developed 5 district crisis response teams to provide immediate support to cases of violence. This initiative has lasted beyond the life of the program, which came to an end in May this year. The ripple effect of all these interventions and programs are endless. And this is the very real and lasting impact that Alliance India can bring to the partnership at Frontline AIDS. And this is why we think they are such an important partner to work with. They have reach, they have impact, they have expert staff with a deep understanding of the communities they are working with. All these factors mean that they're able to implement sustainable programming that becomes embedded in those communities who need it most. At Frontline AIDS, we want to ensure that we're supporting and amplifying the voices of those most marginalized. Through Alliance India, we know we are doing just that, and that those most marginalized are at the forefront of all that they set out to do. Let me end on a personal note. I've known the team at Alliance India for over a decade. I've known and worked with 4 EDs in that time, all of them different, but all of them inspiring leaders in their own right. We've been through challenging times, times of great success, and sometimes through crisis together, such as the recent COVID pandemic. I've been always super impressed by the reach, the depth, and the commitment that Alliance India has shown in their programming, in the way they deal with people, in the way that they behave in a global partnership. I have many fond memories of sitting with staff in Delhi and other places, visiting community groups, working on very complex HIV prevention and treatment programs. And I have seen how the organization has managed to sponsor and grow talent from very marginalized communities to become part of Alliance India's staff. I'm full of pride for this partnership, and I'm looking forward to many more years of friendship and of professional collaboration. I wish you well.